guys, Dr. Andy here. Today I want to show you what we do for our runners with patellar tendonitis. Alright, so if you are a long distance runner, or maybe if you're not necessarily a runner, but you spend a ton of time on your feet, you can, and it's really common to develop pain right below the patella. So that is, of course, your kneecap, right? And so sometimes we get a lot of pain all around the knee. More commonly, we develop like pinpoint pain right below the hard bony patella into the tendon right here, and that is your patellar tendon, okay? And the reason why this is so common to aggravate is because it's actually the insertion point for the entire quad muscles. So your quad muscles, they're huge, big, beefy muscles. They go down through your patella, and it narrows down even farther and attaches right here to the tibial tuberosity with the patellar tendon. So all of that muscle tension and all of that work and strain and stress goes into this tiny little point, all right? So as a result, if you're a runner on your feet a lot and you are using these muscles a ton, right, it's really easy to develop a repetitive stress injury, okay? So with a repetitive stress injury, it means that we are wearing down the tissue. Things are breaking down slowly over time. We're developing almost like scar tissue inside that tendon. And as a result, we get chronic pain, okay? So when we get chronic pain, meaning it's not like you went on a run yesterday and it was your first run and now you're feeling pain and that pain is coming from that one run, okay? That's not how it works. With a tendinopathy, all right, it means that this has been coming on for a long time. You might have started to feel the pain yesterday, but I can guarantee you the reason why we're hurting is because we've been building up that damage in the tendon over several weeks, maybe even months, okay? So when that happens, there's a lot less blood flow to the area. The pain is not coming from inflammation. It's coming from like a lack of blood flow, and things are just kind of, as I was saying, underneath, almost like we've developed some scar tissue underneath here, okay? And that's why Shockwave works so darn well for this issue, because Shockwave is designed for chronic problems. What it does is it uses really, really powerful sound waves to go in deep, breaks up the damaged tissue, like the scar tissue inside the patellar tendon. Your body starts to clear out that damaged tissue through your lymphatic system, and then mesenchymal stem cells flood to the area and rebuild healthy tendon from scratch. So that's why I love this. It's fantastic in terms of regenerative type treatment for long term. But of course, we do have some short-term benefits as well, okay? We do get some immediate pain relief with this treatment, and it comes from basically clearing out something called substance P. As you can imagine, P stands for pain, so it gets rid of the substance pain, and we feel better immediately, okay? How do we do this? Shockwave typically takes around 5-10 minutes here in the office, can be even longer depending on how we do it. We lay down a little ultrasound gel. That gel helps the sound waves get transmitted from the headpiece into the skin, all right? And we stay right here, right on this patellar tendon. This is where all of the damage is. So we're gonna spend a good 5-10 minutes hanging out in this area, breaking down the damaged tissue so that we can rebuild some healthy tissue. Now there's different ways that you can do this. The way I'm showing you right now is more of in a passive manner. So Regina's just hanging out with us. She gets to relax, she gets to take a nap, and we're just, moving the headpiece as the leg stays still, right? There's other ways we can do it. We can actually, after maybe about 2,000 pulses laying down, we can actually stand you up. We can put you in a load-bearing position, maybe do a little bit of flexion and extension with the knee, and we can actually hold the headpiece on the patellar tendon as you are load-bearing in a standing position. It gets like a little bit more intense and a little bit better depth, and a little bit better results as well, okay? So that is Shockwave, what we do for our runners with patellar tendonitis. As I said, you might have developed this pain yesterday. You could have been dealing with this pain for months, and if it's really nagging and you need to do something about it, there's not a whole lot you can do in terms of like how do we get some immediate relief. So Shockwave is a fantastic option for the here and now in terms of I want to feel better right now, but it's also regenerative in that we are fixing the problem deep underneath so that we're getting rid of it for good, not just creating a short-term relief, okay? So that's Shockwave for patellar tendonitis. If you have any questions, send them my way, and always remember to live with passion. not pain.